Violation of the isolation is being laid out when you've been told to stay home, and it says it's a crime. It could result in a misdemeanor offense, punishable by 1 year of imprisonment, or a fine of up to $2,000, or both. Amanda Hull is working for you tonight.
As COVID cases continue to surge locally, many people will enter isolation after testing positive for the virus. So what do you do if someone you know tests positive and doesn't honor their isolation? Erin Killian from Tully, Rinckey Attorneys and Counselors at Law says people could possibly face legal consequences.
Each day that you violate that quarantine would count as a separate violation. However, the law is not settled on what exactly a violation is.
Right now, breaking an isolation order in New York State is punishable with a year in prison or up to a $2,000 fine. Yet Killian thinks fines would most likely be the punishment.
So the law does specify that if you're in your house or your apartment, you may go outside while remaining on the premise, but you can't leave the actual premise or come within 6 feet of any person who does not reside at the premise.
But also leaves some to raise the question on whether it is a civic duty to report or spying on your neighbors, and what's the difference?
And it's very tricky to enforce because there's not exactly someone watching you all the time. It would come down to your friends or family or coworkers, and people may be reluctant to report these people that they know personally. So it'll be interesting to see how the law changes. At this point, not much is settled.
The Onondaga County Executive's Office said if you would like to report someone breaking an isolation order, you can contact their law department. We have the phone number for you and a list of isolation orders with their penalties on our website, cycentral.com.
Thank you, Josh. There's still no vaccine for children under the age of 5. And as COVID-19 cases among children soar higher than they've ever been, parents are increasingly worried about not being able to vaccinate their children. Our Samantha Croston spoke with one of those parents tonight about their feelings about not having that vaccine, especially for the younger children. Samantha.
Well, the parent who I spoke with says that once during this school year, her son was quarantined for 20 out of 28 days because of exposure to COVID-19. She's worried about him contracting the disease, but is equally worried about his mental health.
We've heard the narrative throughout the pandemic that COVID-19 tends to be less severe in children, but health expert Cynthia Leifer warns that there still is danger, pointing to 300,000 children in the last week testing positive, 2,000 of which are in the hospital.
They're still getting sick. Parents are still losing time where they have to stay home with their kids that are sick. And so I think it's just a forgotten part of our population.
This is a feeling Kylie Triolo of Ithaca can relate to, having a 4-year-old son who is unable to get vaccinated.
We're here on this planet to give him a healthy life and, provide for him. And him not being vaccinated definitely holds us back. And it does not feel like we're anywhere close to being done.
Currently, clinical trials for the Pfizer vaccine for children under 5 are underway at 90 sites and involving over 4,000 children. Upstate started a trial process last April. However, Pfizer's last round of trials was not enough of a success.
They tried to use a much lower dose, and it didn't reach enough protection to be approved. So they're going back into their clinical trial and seeing if they can give an additional dose or give a little bit more in the vaccine.
Until it is approved, parents of children under 5 like Triolo have to face challenges. She says she has stopped telling her son about big events until the day of for fear of it being canceled.
My parents came up for a day and a half for Christmas, and it's like he didn't know until they pulled in the driveway. Just because we can't tell him these things and have him be let down.
Leifer says that the hope is to have the vaccine for children under 5 ready by later this spring or the summer. How long that takes depends on the success of the clinical trial.
I've been talking with parents about students returning to the classroom, and one thing I've heard a lot of is parents wanting to go remote. So today I looked into how that shift from classroom to home could happen.
Really think there should be a remote option.
Students are back in the classroom after winter break, and the return to in-person learning is not something every parent wants for their child right now. A Fulton mother I spoke with would like her high school senior to be remote.
An option, I think, would be prudent right now with the positivity rate being so high and the hospitals being so overwhelmed.
This is a message many parents across central New York have shared with me. Concerns about the highly transmissible Omicron variant and potential cases from holiday gatherings still not shown. So, should families get a remote option now? It's not as easy as yes or no. The Jordan Elbridge superintendent, for example, tells me they don't have the capacity to do both at the same time. The Rome superintendent explaining that takes months to plan for, from organizing schedules to selecting remote teachers to signing students up. It's not a simple process, he says. The state education department listed in this year's guidance, quote, so long as allowed by public health officials, schools should be open for in-person teaching and learning, but they add districts should be prepared to provide remote instruction. It continues to say, quote, districts may work with students and families to offer remote options if it is deemed to be in the best educational interest of the student.
Other people need to understand that some families may have someone that has an autoimmune disease in their family and might have a worse outcome if they catch COVID.
When it comes to the social emotional benefits of being in person, the Fulton mom says that's important, but staying healthy is too.
You know, that sentiment needs to change with how the virus changes.
The Fulton mom also said that there was more available when the positivity rate wasn't as high, like less of a demand for COVID-19 testing. The Rome superintendent says if offering a fully remote option next year is a thing that has to be decided soon so districts can finalize their 2022-2023 school year plans over the next couple months.